Breast lift surgery is designed for women who have sagging breasts, who've lost some volume in their breasts, women whose nipples are too low relative to the breast tissue. And it's an operation that repositions the nipples and reshapes the breasts. So you have perkier, more youthful looking breasts. It also removes extra skin in patients who have loose skin, where that's a component. A lot of women are very self-conscious about their breasts. There is a lot of attention that is paid to a woman's chest size. Women are very conscious about how they look, both in regular clothing as well as in brasiers and undergarments, as well as in bathing suits. They usually come in about half an hour before their surgical time. They will meet with me. We will discuss the procedure. I will mark the patient. They spend about an hour to an hour and a half in the operating room, and then they will recover in our recovery room after surgery. Usually patients will spend about an hour in the recovery room, and then will leave the office in the company of an adult and go home. All in, you're looking at somewhere between 3 to 4 hours, perhaps on average, from the moment that they come into the office until they go home. For most patients who have a breast lift procedure, they're able to resume most of their activities of daily living immediately after surgery. They just can't be doing any sort of heavy lifting, vigorous aerobic exercise, or anything that will demand a lot of strenuous activity for about 2 weeks after surgery. So one of the most important things that patients need to understand is that there are a lot of different techniques. There are different indications for breast lift or mastopexy surgery, and there are also those patients who would benefit either from having purely an augmentation surgery or from having an augmentation performed at the same time of a lift. Another discussion that's very important prior to performing a breast lift is understanding whether a reduction needs to be performed at the same time. Some patients feel like their breasts are just too low, when in actuality, they're also too large and there's excessive weight that's pulling down on the breasts, and that is causing the sagging appearance. One of the nicest things that we do as plastic surgeons is that we can help patients feel better about how they look, and it really has a very widespread positive effect on their entirety of their lives. We have a lot of patients who feel like their whole lives have been transformed, and that's really a wonderful, rewarding part of what we do as plastic surgeons.